Hi, welcome to Medical Health Institute. We are excited about your new journey. This video is to show you how to extract the medication in order to inject it. We have an alcohol swab here. We have a testosterone vial here. We have a 20 gauge 1-inch syringe, which typically that's what's used to extract the testosterone medication. And then you have a 23 gauge 1-inch, which is typically what you use to inject the thigh, glute, or shoulder muscle. A 1.5 inch can be also used for those that have a little more body fat composition. And here's a syringe which we'll use to extract the medication. They can come in 3, 5, or 10 ml. It doesn't matter. Whichever one you get is the one that you're gonna use to extract the testosterone. And the 29 gauge is an option to use as well for testosterone. For the sake of the video, we're gonna start with the traditional way of injecting testosterone. So typically you'll find in your package, when you receive your medication, a syringe just like this. Typically you'll find that it goes up to 3 mLs, 5 mLs, or even 10 mLs, like in this syringe, which in any of the cases, it doesn't matter because the most the doctor will prescribe is up to 1.5 mLs of testosterone. So we are gonna use this syringe to extract the medication. So as I said, we're gonna open up a 20 gauge needle tip. We're gonna screw on the needle tip. Then we're gonna come and open the testosterone vial, take off the cap, the security cap, grab again the syringe, take out the cap, put the plunger right into the middle of the medication, flip it over, typically 90 degrees, and then you extract the medication. So once you're done extracting the dose prescribed by the doctor, you're gonna pull out the vial, grab again the needle tip, unscrew the needle tip, and use the 23 gauge 1-inch or 1.5 inch to inject. So we'll open the 23 gauge. We're gonna screw it on nice and tight, pull out the cap. You're typically gonna flick the syringe until all the air bubbles come up, and then you're gonna push the plunger until there's no air. If you do have an air bubble, do not worry about it, as you would have to inject 3 mLs of air into your veins in order to have any cardiac shutdown or any issues with the injection. So once you're ready to inject, you want to make sure you use the alcohol swab on the area of injection to make sure you wipe it clean before every injection. Once you're done injecting the medication, you want to use a sharps container. You can purchase this directly with us, with your treatment, or you can go to any primary pharmacy like CVS or Walgreens and buy this for $15 to $20. Once you're done injecting, you open the sharps container, dump the syringe. Now, we have an optional way of injecting testosterone for those that are freaked out by syringes like the 20 or 23 gauge, which we understand. We can also use a 29 gauge. However, for the 29 gauge, if you're gonna go intramuscular, you must be pretty lean in order to get the medication intramuscularly. Or we can use it sub-Q, meaning we can inject it to the fat. That's an other optional way patients use testosterone. So we're gonna grab a 20 gauge needle tip to extract the medication. We're gonna grab the syringe. Once you put it in, screw it on. Once it's nice and tight, we typically recommend that the patient, if they're gonna be injecting on a weekly basis, or even if they split the dose, better yet, they're better off pre-filling 4 to 8 syringes. So we're gonna pre-fill a month worth of injections, depending if you inject once or twice a week. That's gonna be anywhere from 4 to 8 syringes pre-filled. We're gonna take off the cap. We're gonna extract anywhere from 5 mLs or more if needed. Put the cap that back down. We're gonna grab now, I'm gonna put down the syringe. Typically the 29 gauge or any insulin syringe has this cap to make sure that you know it has not been used. You're gonna take off the safety cap, pull out the plunger, excuse me. Put the plunger down somewhere where it's clean. You don't want to put it anywhere. Take out the cap. You're gonna pre-fill it. So in this example, we're gonna do 100 milligrams, which would be 50 units on an insulin syringe. Put the syringe back down. Put the needle tip on it again. Put the plunger back into the 29 gauge. Flick out the air. Once you push it up and you have a drop come out, it's ready to inject. Now typically we use a container like this or an empty prescription bottle so you can pre-fill your syringes and leave them pre-filled for the entire month. You want to keep it in a stored place where there's no heat nor light in order to not damage the medication. And testosterone is never refrigerated. It's kept at room temperature. In this video, we're gonna demonstrate an intramuscular gluteus injection. You would typically inject in this area testosterone, vitamin B12, GAC, or GOL, or any other medication that you might be using intramuscularly. So you always first, as always, start with an alcohol swab. You want to clean the area. For intramuscular gluteus injections, you typically want to inject on the upper outer quadrant of the buttocks. Once again, I'll repeat that again. You want to inject on the upper outer quadrant of the buttocks. You want to stay as calm and as relaxed as possible in order for the muscle fibers not to contract and feel any type of pain sensation. Now, for the sake and purpose of this video, I will be using a 29 gauge for the gluteus muscle. Believe it or not, you can get in there if you're pretty lean and have low body fat composition. Typically, you would inject with a 23 gauge needle tip like this one. Now, I will be using a 29 gauge 1/2 inch. The area is clean. You go to the upper quadrant and you inject. You grab, I like to grab the thumb and push it in, or you can use whatever finger feels more comfortable. Once you're done, you pull out and you massage the area if you felt any pain sensation for about 30 seconds and done. Intramuscular thigh injections. You typically use the thigh for testosterone treatment, B12, or GAC or GOL, or any other medication you might need to use intramuscular. Now, we first begin always by cleaning the area with an alcohol swab. Obviously, with the alcohol swab, make sure you clean the rubber top of the vial as well. Typically, how you measure the area you want to inject, you want to grab your index and pinky or even thumb, and you want to find basically a little higher than the mid part of the thigh on the outer quadrant of the thigh. Here's the middle, the part that breaks down the thigh in the middle. You want the outer quadrant of the thigh right around the middle or even a little higher. It's fine either way. So once the area is clean, a method a lot of people use, they push down on the skin and press out by tightening the skin, typically you feel almost nothing here. So you can either dart it or push it in. And then with the thumb or index finger, you can push the medication in. Once you're done, you pull out and you can massage the area for about 30 seconds if you feel any pain sensation. For intramuscular injections, always start off by cleaning the area with an alcohol swab. In a circular motion, you want to make sure you clean the rubber top of the vial and the area of injection. So intramuscular injections typically are for testosterone, B12 injections, and GAC or GOL. They're amino acid blends. Or anything else that you might be injecting intramuscularly, you want to wipe the area clean. For the sake and purpose of the video, I will be using just B12 and an insulin syringe, 29 gauge, ½ inch. Now, for testosterone, most likely you'll be using a 23 gauge or 25 gauge, 1 inch or 1.5 inch. Or the optional way of doing it, if you're pretty lean, can be done with a 29 gauge, with the one that I'm gonna use right now. So, take off the cap. Before you inject the shoulder, you wanna place your index finger right at the bony part of the shoulder, and from there, bring 3 fingers down until you find basically the mid part, the most chunky part of the shoulder, right around the middle. You will grab the syringe. You can either dart the skin or push it in. No pain, nothing. And then slowly, with your index, or depending on what you're comfortable with, you push the plunger down. Once you're done, you pull out the syringe, put the cap back on it, and you can rub in the area for about 30 seconds so the medication can spread throughout the skin. And you're done. If our doctor prescribed you 2 or more supplements, then we strongly recommend that you buy a multi-week vitamin packet like this one. Reason for it is to make it easier and more convenient for you to take your supplements. So typically you would fill from Sunday down to Saturday your AM and PM supplements. Our doctor typically divides most of the supplements into AM and PM. Or some like magnesium, he would only tell you to take it PM. But we strongly suggest that you buy one of these multivitamin weekly packets. So once you have your multi-week vitamin packet, and let's say the doctor prescribed you 4 capsules of a certain supplement and he told you to take them 2 AM and 2 PM, then we recommend when you have your supplement vial, get a Sharpie pen and mark down basically how many you're taking per day. In this case, it would be 4. And then you would place AM and PM. Therefore, you know you would have to divide the dose into 2 doses per day. And that goes on, whether it's 2, you put 1 in the AM and 1 in the PM, and then you would fill in individually each one.